Welcome to Keeping Secrets, hosted by Julia Baum and Sabrina Tropper.
We're two licensed therapists here to give you an insider's perspective on therapy in today's modern world.
Whether you're a therapy goer, you've never been to therapy, or you have experience in the field, this podcast is for you.
We thank you for listening. Subscribe to Keeping Secrets to never miss an episode, and we hope you enjoyed today's show. Hi, Julia. How are you?
Hey, Sabrina. I'm good. How are you?
Good, thanks. So today we're going to talk about expectations versus the reality of our profession of being a therapist. Generally speaking, I think that we both had very different expectations versus actually going into the field and seeing what the reality was or is. So I'm curious to know, when you hear me say the expectations you had as a therapist coming in, what comes to your mind?
I think going in, my idea of who a therapy client was and the type of person that I, as a therapist, would be working with was very, very narrow and very limited to my experiences in life. And I think getting into this field, it was a big leap into a much bigger world than I realized existed. But yeah, I think initially I had a very, very tight idea of the type of person that goes to therapy and what they're looking for in therapy and what the therapist is doing with them. So that has been blown out of the water since getting into the field. What about you?
Well, yeah, I mean, it's the same with me as well. Like, my expectations were, I think they were just like totally unrealistic. I thought I had very stereotypical ideas of what that would look like. But I did have a question for you. You said your view was narrow.
Mm-hmm.
Can you give me an example?
Yeah. I mean, I was just kind of thinking everyone's like me. And so the things that I would want to talk to a therapist about and the kind of problems that I deal with in my life, I thought that's just the case for everyone. And just very oblivious to the wide scope of life experiences and challenges that people deal with, and just different realities that people exist in. And, you know, like what matters to people, it goes in different orders. You know, values and priorities are ranked differently person to person.
Right.
And so I just thought everyone is basically like me, which, I mean, like in essence, I guess there's commonality among human beings.
Yeah.
But just, you know, the kind of topics that were on my mind and, you know, the things that I wanted to talk about, I just assumed this is what everyone is thinking about and worried about. And that's what I'm going to be dealing with day in and day out if I'm a therapist working with people.
Okay. That makes sense to a certain extent, because I'm guessing you only had yourself as a model.
Mm-hmm.
And especially when we're younger, I think we tend to be very, I don't want to say like well, yeah, we do tend to be more self-focused when we're younger. At least I was, and most of people I was surrounded with were, because you're trying to figure out your identity and who you are and what you're going to do in life, or what that's going to look like. But, you know, it's interesting that you felt you had this narrow focus or image, I want to say, of what that was going to look like. I feel like mine was the opposite. It was like anything goes. Like I'm going to have, like, you know, somebody that's, you know, that it's like a super high powered lawyer coming in and telling me some, you know, again, it's very stereotypical stuff that I probably had seen on TV or whatever.
Yeah.
they're going to come in and they're going to tell me about an affair, and it's going to be scandalous, but also like I'll get really invested and I'll want, to help my client and be the savior kind of thing, to
Uh-huh.
like, a person that like can't get out of bed in the morning and comes into the office, but still somehow comes into the office and then has like what I, in my mind, envision to be almost like a breakdown. And I'm putting that in air quotes because that's not a real thing in our field. It's really what I was thinking of was like a panic attack or something, someone having a panic attack,
Mm.
which, yeah, that actually has happened before and probably will continue to, because that's, anxiety is one of the things that I work with, but not in the way that I thought.
Yeah. So how is the reality of your actual work as a
Yeah.
therapist differing from that that
Yeah.
imagined career?
Well, I want to say the biggest thing is that I get to choose who I work with.
Mm.
And that has been both really freeing, and I think also is beneficial for the people that I work with, because I truly just work with people I want to work with most of the time. And that doesn't mean that some of them aren't harder than others. It certainly they are, that have a whole range, but it's a it's more of a defined group, and it's more within a certain age range. And typically, it's not like in an inpatient setting at a hospital where people are, in crisis and they have a full team of doctors around. And if they need an injection of some sort, they can get it. And, that's like crisis management and very severe persistent mental illness. This is in private practice where I'm working. These are everyday people with, you know, issues that, yeah, some of them have diagnoses, but they're still able to live full lives, if that makes sense. And their
Mhm.
lives are very similar. A lot of my clients struggle with similar things that I've struggled with, or that people I know and my family and friends struggle with. I think it was really like, I thought there was going to be more of a separation or something
Mm.
between me and my clients. I don't know.
Interesting. I guess in a way we're sort of saying opposite things, but I can also
Yeah.
completely relate to what you're saying too.
Yeah, how so?
Yeah, I mean, I feel like I've been through, if not exactly what my clients have been through, at least like the emotional or the
Yeah.
psychological, parallels of what
Yeah,
clients are going through. And, if not exactly the same scenario, then it's like at least
like pretty
I've
similar.
felt the way they're feeling, I think.
Yeah. I don't think I realized or recognized how helpful that can be as a
Hmm.
therapist to your clients, because it's like you fast track straight to the problem if oh, I've felt that before. And if you're assessing it properly, or you have a good sense of like, this may be what they're thinking and
Hmm.
feeling, and of
Hmm.
course you're looking for cues, it really makes it easier. And I mean, it's
Yeah.
not easy, but you know what I mean.
Yeah. Yeah. So in that sense, yeah, I think life experience has a lot to do with how you work as a therapist.
That is not something that I knew going in. No clue.
That's true. Yeah, I was very
Yeah.
focused on learning about theory when I was in grad school. I was
Yeah.
super fascinated with learning about all the different theories and the techniques and
Of course.
interventions. And yeah, but I think the more seasoned you are as a therapist, the more you can kind of integrate that into your own way of being a therapist instead of kind of
Yeah.
mimicking techniques that you've learned about. Or, it's more like they come
Yeah.
through in your own way, like an
Yeah.
artist.
Yes. No, that's absolutely right. It's exactly like an artist. And, for those of you who don't know, Julia and I both come from background of more artistic beginnings, I want to say. Like, you majored in photography, is that right?
Mm-hmm. Yep.
Yeah, and I majored in music, playing saxophone actually in undergrad. So very different. We ended up in different fields, but I see that quite often, that a lot of therapists are coming to this from like as like a second profession and from like a wide array of different fields.
Mm.
But I have seen like I've noticed like there does seem to be a link between that artist. I think that's my theory.
Mm-hmm.
Between like the artist in us and what we're doing, because it's not the same as like a medical doctor. It is healthcare. It absolutely
Mm-hmm.
is, but it's not the same,
Yeah.
you know?
It's
So that,
emotional health care.
yeah,
Yeah. Yeah, that's actually an interesting aspect of our work is the creativity piece.
yeah,
And I didn't even understand that in the beginning at all. Like, I
no,
remember specifically for my internship when my supervisor had to kind of score my performance, and we would go
oh,
over that together. And one of the things that needed to be rated was the level of creativity within the
oh,
therapy. And at the time, I was just like, how how could you possibly be creative? I don't understand. Like, and
yeah,
I don't know. That took a long time because
yeah,
I do think it's the same as any art form or craft or, anything that you learn, you kind of have to learn it so well that you can throw out the rules and somehow
yeah,
still get it.
yeah. I think that's a perfect way of saying it.
Yeah, I think
Yeah,
as like a brand new therapist in training, I was just kind of constantly going through like the Rolodex of if this, then, like
yeah,
if the
yeah,
client does this, then
yeah.
I will do this. um,
Yeah, kind of like a robot in a way.
yeah, and like kind of
But
trying to prepare in advance and just,
I did
but
that too. Yeah.
now it's much more like I feel fine just rolling in, and because I'm a lot more
Yeah.
organic and
Yeah.
probably creative. But anyway, I think that's an aspect I had no idea was a part of being a therapist.
Yeah. I'm so glad you brought that up because I also think that I don't know, when we were like initially when we decided to do this episode, we had thought about some ideas here and there. It did not occur to me that there is that creativity aspect. And, this could bring us down another like avenue or sort of path talking about like what does creativity even mean. But I think in this context as a therapist, being creative means being able to adapt in the situation that you're in with the individual that you're with, and drawing not on just theoretical sort of ideas of, or theories that are important to learn, and techniques that are useful in certain situations, but being able to like integrate that in the moment as it's happening.
Hmm.
And that's
Yeah.
hard.
Yeah. I think that's kind of a defining factor of a therapist's experience level.
Yeah.
Yeah, like how able are they to kind of authentically and organically respond to that
Yeah.
precise moment, like with this very person, and even being able to feel that out beyond just like if there was like a transcript of the conversation and like what would be the
Yeah.
appropriate response, and write it out. It could be
Yeah.
really different than in the moment being able to read the energy and the emotion and like the eye contact and everything, and
Yeah.
just being very like genuine in whatever that response is.
Yeah, you kind of have to tune in to
Mm-hmm.
the experience. And it's like, on one hand, I feel blessed in the sense of like every session I have, I'm not bored, I'm never bored by what comes up, even if it's like, we're working on the same thing for a while, which happens. But I don't know, there's always a curveball. And so it's like we have these theoretical models and these techniques that we use as therapists, and God knows there are so many acronyms for the different like techniques out there. I could list them all off in
Mm-hmm.
just a tongue twister of different techniques
Mm-hmm.
and things, but none of it really, it doesn't it doesn't do justice to like what is happening in the moment. Um, and I think, yeah, that experience is just so important as a therapist.
Mm-hmm.
Yeah.
Yeah. Yeah. I see us as like both artists and craftspeople.
Yeah. Yeah. You need the background too and
Yeah.
some of the knowledge to
Yeah.
know.
Yeah. Yeah. As well as like philosophers and,
Yeah.
you
I've
know,
heard, yeah, that
yeah.
said.
Yeah. But anyway, so, I guess I'm curious, what were your expectations beforehand in terms of how clients may impact you or your life?
That's a great question. I don't think I really knew or even took that into consideration. I'm a bit embarrassed to say. Like, I think I just assumed that, okay, I'm going to go get some training in this, get some experience in it, and I'm just going to learn how to sort of compartmentalize or create adequate distance that both maintains the boundaries of the relationship between a client and a therapist, and also, the idea of vulnerability was not top of mind back then, I think. Um, yeah, because I mean, I got my degree before or right around the time that Brene Brown came out with like that vulnerability study that she did. That's so groundbreaking, and so vulnerability. I think when I was just going into grad school was not very popular, actually. I know that's a little off topic, but I think it's related in the sense of like just the fact that people come in with going through experiences that we've gone through as well. That is it's bound to bring up countertransference, which is, for those of you who don't know, is a fancy sort of word for, and please correct me if I'm wrong, Julia. It's sort of like when something happens in this session that reminds you of something personal, or reminds a therapist of something that is personal to them, and they sort of lose objectivity a little bit in that moment. And so, and that happens often because we're people. And so the guidance is like, okay, well, reflect on it afterwards. Go and consult with a therapist, another therapist, and try to figure out what happened there. But yeah, that countertransference it's important and part of the work and to be expected, I think.
Yeah, that's actually a good point about Brene Brown coming out with that, because I remember being assigned to watch her TED Talk for one of my classes in grad school.
That's so
And
funny.
that's, I think, a really good example of how these like cultural shifts, or, like
Yeah.
popular buzzwords in the zeitgeist and stuff, they really
Yeah.
do affect therapy. And I mean,
Yes.
it has become so much more common that therapists are more transparent than they used to be. Like the
Yep.
really stereotypical, like Freudian therapist who is
Yeah.
a blank slate.
Right.
They're not even looking at the client.
Yeah,
The
they're
client is
taking
the
notes.
patient, considered
Right.
a patient. And yeah, the Freudian therapist is sitting behind them. So there's no eye contact, and they're just sort of
Yeah.
analyzing this patient and whatever. And now it's so much more, okay, we're face to face, we're being
Yeah.
real, and we're being honest with each other. And people expect that. And I never really thought about it, but I think that the whole like vulnerability movement that Brene
Yeah,
Brown popularized, I think, has a big role in that expectation. And even like
for sure.
therapists being online and having social media accounts and showing
Oh my gosh. Yes.
parts of their personal lives. That is like
Yeah.
so unheard of back in the
Yeah.
day. That would be very, very frowned upon.
Well, yeah. I mean, I remember, I think we were in grad school around the same time.
Mm-hmm.
But I remember when I was in my program, we had an ethics course or a course on ethics and, dual relationships. What does that look like? All that stuff. And the idea of social media, I pretty sure when I started in this field, social media was also, it was more than 10 years ago now, but when I started, it was a no-no. I
Mm-hmm.
had, as soon as we entered into like our practicum and internship sites, our professors were like, make sure that you know, take a look at what's online about you because people are going to want to into that, make sure that you set everything to private. And so I did that. And I think at one point I even tried to like change the names on, well, no, I definitely tried to do that many times on one of the accounts. So, but that has totally shifted as well. Like, like you're saying, you have therapists now that are like really, because people want that vulnerability.
Mm-hmm.
Um, it's like the field has done a 180 from the Freudian sort of
Yeah.
time.
Yeah. And I think from the time we started grad school to now, things have radically changed in a lot of ways. Like,
Yeah.
even now, walk and talk therapy is like more and more
Yeah.
of a thing, which I think became a lot bigger during the pandemic, especially.
Yeah.
But before that, I think that was viewed more popularly as like breaking confidentiality and it's just
Yeah.
different. Like what people believe is acceptable and what they expect has really changed. And
Hmm.
we're like kind of always trying to pick up on what's going on because we learn a certain thing and then that changes. And
Yeah. And we have to just
yeah.
adapt on the fly to it.
Mhm.
You know,
Mhm.
we don't have a
Yeah.
choice.
Yeah. Yeah, and yeah, it happens really quickly and a lot of it is like through popular culture and just how social
Yeah.
norms change. Yeah, it's interesting.
I think from the perspective again of like expectations going into the field versus the realities, that was also something I wouldn't have. I don't know why. It just didn't really occur to me that like, you go to grad school, that's kind of considered basic training for therapists. You do that, and then you're good. The rest is just,
Mm.
you learn on the go. I didn't realize how integral and important it is to keep up with your trainings,
Mhm.
to learn like you're saying, right, the new trends and really get on top of that. And I think one thing while you were talking stuck out to me about this is like sometimes I learn about new cultural changes from my clients, and
Mhm.
it throws me off a little bit. I mean, it used to throw me off more. Now I just like am pretty honest and I'm like, I don't know what that means.
Mhm.
Especially if I'm working with like younger clients, I'll just be like, look,
Yeah.
I'm old. Tell me, what does that even mean? And then we have a good laugh and then they like
Uh-huh.
kind of educate me and it's
Well,
it's
and
like
that's
a
again like
fun,
your vulnerability. Like I feel like
yeah.
in the past your age would have not been something to even comment on,
Yeah.
you
Yeah.
know?
And I actually had a client, or a client inquiry maybe a year ago. Somebody asked me specifically, like pointedly, how old I am, because
Mm.
this person had a very good, well-defined idea of what they wanted to work, or what kind of clinician they wanted to work with. And they wanted someone around their age range. And, that's something that also I've been encouraged by my own consultants and stuff like that to encourage my clients to do, which is like find a therapist that fits, that will match you. You're not stuck with one. If that's not working, you can find another one.
Mhm.
Don't give up, keep trying. But I think again that question can, like, I give that person props because it does make a difference what age range you are. It makes a difference what period of life you're in.
Mhm.
um, it's not like we can't work with people outside of our age range. We can and do all the time, but it makes a difference.
Mhm. So did you tell them your exact age?
I waffled a bit at first and I was a little general about it. I gave her like, oh,
Yeah.
I'm in the early blank. I'm not going to say here either.
See, this is our training. Like it's
Yeah.
so deeply embedded, but I want to say I'm not sure. This would actually be interesting if anyone can comment on this, but I want to say people who are newer to the field or, in training now, I wonder if they would be more,
Yeah.
primed to just say their age or I don't know. I mean, you'd
Yeah.
still want to explore like what does the question really mean to you and
Yeah.
what does the answer represent to you? And I still want to explore that, but I think both
Yeah.
of us are so like indoctrinated into the
Yeah.
idea of being anonymous and it's really hard
Yeah.
to break that training.
It is, and I think that's also been a big part of our struggle
Mm,
in doing this podcast is like
yeah.
now we're center stage right now. I spend my career, being sort of a listener and somebody that facilitates and helps and guides, but I'm not in the spotlight. My client is, and I'm comfortable with
Mhm.
that. I feel like that's maybe the same or similar with you. Is that right? Or
Mhm. Yeah. Yeah, for sure.
so yeah, I mean, yeah, that client inquiry, it was actually a really uh, great consult. It was I was doing a free consultation, a phone consultation to see if we were going to be a good match, if I could, I had the skills, blah blah blah, to work with the
Mhm.
client. Um, and I didn't end up working with the client. They were like, "Oh, that's not." It was an age thing,
Mhm.
and so I asked, like, what is it about that is maybe not off-putting, but not quite what you're looking for? Because I wasn't that
Mhm.
far off age-wise, but I wasn't in that person's range.
Okay. Yeah.
Um, and what they said was that they had a bad experience before with someone, and
Mm.
they felt that that was age related and experience related
Mm.
and stuff like that. And so, that's fair. I'm not going to change that in one phone call necessarily, but I do think it's important for people to feel empowered also to find a therapist that matches somewhat closely what they're looking
Mhm.
for. Maybe not 100%. That might be a little much because that's also what's going on there. But
Mhm.
yeah, if you want someone that is in the queer community, for example, because there's a lived
Mhm.
experience there, or, a therapist of color, or,
Mhm.
any other kind of minority, there are websites for that now
Mhm.
and search engines. But that
Mhm.
was not the case when we were in grad school.
Yeah, no, that wasn't very common. Yeah, that's
Yeah.
become a lot more prevalent for sure.
Yeah.
Yeah,
It's a lot.
I know. Yeah, it's like an endless topic in a
I
way.
know. I'm like, we could just
I
keep
know.
going, and
I
we'd,
know.
never stop.
But I also want to say that there is some validity still to a therapist having some anonymity in the relationship. I mean,
Yeah.
I think
Yeah,
the idea
for sure.
is I try to be very emotionally transparent and honest
Mm.
about like what I'm thinking and feeling in a session. But in terms of details about my life, I, based on
Yeah.
my training and experience, I often don't see that as a benefit to the client. So I leave that out. But
Yeah, I do
I
too.
think attitudes about that are definitely changing. I don't know. I would be very curious to hear from both like therapists that are, in training now or,
Yeah.
are very early in their career or also on the other end, like much, much later in their career and have trained like much before
Uh-huh.
us. Which was like in like the early
Two.
2000 teens ish.
Yeah. It would be like prior to 2012, 2011, 2010, that
Yeah,
era, like
yeah.
that
Yeah.
decade.
Yeah. I mean, yeah, to think about how much
Yeah.
things have changed like decade to decade, it's pretty dramatic.
It really is, and it has such a profound effect in therapy because, the way that cultural shifts occur is like, you know, it's kind of a mindset shift. So you have to actually really have some facility or comfort with what's happening in the here and now, because
Mm-hmm.
that's the context that your client is bringing in with them.
Mm-hmm.
Um, I'd also be really curious to hear maybe if we have any listeners right now, if from anybody about, you know, what their thoughts are about, you know, what would be your preference for in a therapist? Do you want a therapist that just kind of really tells you all the details about their personal life? It's even hard for me to say that because I'm like, that's no, never.
Yeah,
No, it's like I'm like you, I'm trained
I
not
know.
to do that.
Yeah. I think it's also so person to person. Sorry to interrupt you.
No, go for it.
Yeah, I think it's also about the dynamics of the relationship, like,
Hmm.
and how that information is being used in the session. And
Yeah, that's a
yeah,
huge part of it. You know,
yeah.
there are some things that, or like situations where I think it is valuable. Um,
Mm-hmm.
I'll give you an example with people who are career changers, and not all of them,
Mm-hmm.
but especially someone going into like a health field specialty or something like that. And I've done this. I'm thinking about a case a while back, but I waited. I didn't say to them that, oh, yeah, I'm a career changer too, even though it's on my website. Um,
Mm-hmm. Mm-hmm.
and then finally just kind of blurted out like, it wasn't a blurt. It was like, I think this might actually make this person feel a little bit better and less alone. Um,
Mm-hmm.
is that, you know, I pivoted as well, and
Mm-hmm.
I did perfectly fine, and I'm okay. You know, I'm now in the profession I was aiming for, and it's all good. It worked out, and
Mm-hmm.
I could just see the relief in that person's face.
Mm-hmm.
So, but I feel like there is a line like where it's no longer like I don't want to hear my therapist like comparing stuff that's happened to me to them, you know, like I feel like that's
Mm-hmm. I know
personally I don't like that.
it really is an expert dance. And I
Yeah.
think it's all about the intention too. Like
Hmm.
with with what you shared, the intention was to help them kind of break the idea that they're the only one who's ever done this.
Yeah.
And that was the idea behind it. It wasn't like to be like, oh, well, this reminds me of when I transitioned my
Yeah.
career. And I feel like talking about that now, you know?
Yeah, but that's, you're right in that's the part that makes it a craft, right? Is that
Hmm.
you're intentionally shielding parts of yourself while also being vulnerable. How do you do that without giving personal details? It's hard.
Hmm.
So you have to work.
Hmm.
For me, I think of it as, okay, I'm going to shift to the emotional stuff, and I kind of gauge like what this person might be feeling, and then we kind of go into that. And but yeah, I've had clients for years that don't know anything about my background, or
Yeah.
if they do, it's like just a couple details, you know? I
Same
don't know.
here. Yeah,
So interesting.
it is. Um, yeah, I think unfortunately we'll have to just
I
continue
just,
on with this another time, but
yeah,
I would really love to hear from anyone listening and their take on any of this
yes,
stuff in terms of like therapist vulnerability and disclosure,
yeah,
from the therapist perspective and the client perspective. It'd be really
yeah,
interesting.
it would. And even for people who've never been to therapy, what they would imagine
Hmm.
that looks like, I'd love to hear from anyone. Like, what do you guys think about therapist self-disclosure? You know,
Yeah,
what are you comfortable with, kind of
yeah,
thing?
yeah.
Yeah.
Um, and yes, one of our strengths is that we can kind of explore any topic, and somehow we've
Yeah.
gotten onto a very specific topic from our expectations versus realities conversation. But
Yes.
um,
We meandered.
yeah,
That's all right.
um, all right. But until next time,
Until next time. And Yeah, we might do a follow-up to this. We might not. We'll just
Yeah. I mean, if we
wait and
hear from
see.
anyone about this, I would definitely love to process that
Yeah.
together on the
Yeah.
show. But all right.
All right. Have
Well,
a good evening
you too.
or afternoon.
Bye.
Bye. You were just listening to Keeping Secrets, hosted by Sabrina Tropper and Julia Baum. If you like what you heard, leave us a review or a comment. We'd love to hear your suggestions, comments, questions, and topic requests. We do our best to respond to every single one, and you may even hear yours discussed in an upcoming episode. And don't forget to subscribe to our YouTube channel or wherever you listen to podcasts, and find us on Instagram and YouTube at Keeping Secrets Pod.
Keeping Secrets is the brainchild of Julia Baum and Sabrina Tropper, who also produced and directed this podcast. We're also responsible for all writing, research, graphic design, sound engineering, and video editing. Transcriptions by Riverside. As a reminder, this podcast does not constitute medical advice. While we strive to share the most accurate and up-to-date information, human error is to be expected, and this podcast is purely for entertainment purposes.